time that these so-called hotspot areas were initially spoken about, you questioned it quite, vociferously, because you said, well, it doesn't make sense how they could have arrived at that conclusion. You've had a chance to do a bit more work on it. Tell us about why you think the methodology is flawed.
Well, firstly, I think they haven't explained their reasoning properly. So it's very hard to be able to assess exactly what they have done. So one of the ways to compare the hotspots is to look at what they've put in their list with the police's list of stations that report the 30 highest number of rapes in the country. And there's some very odd omissions there, like Toyando. So if you're going to be giving police stations extra DNA evidence or crime connection kits, then in theory you should be having all your high risk or high number rape stations reporting a high number of rapes on your hotspot. But there are, as I said, at least 8 stations which don't feature at all amongst the hotspots. So there isn't a good match there. So that's the first problem. The second problem, I think, is underreporting, which we've discussed before. So it's clear that the police have tried to correct for that to some extent by looking at Tutuzela care centres, where you can get some indication of underreporting, because people go there, but they look just for help in the examination. They don't actually want to report. But even then, we can see that that number is very significantly undercounts the number of rapes that are occurring. The third problem that arises is the fact they haven't controlled population size. So that means that provinces with very large population, like Gauteng, West Cape, KwaZulu-Natal, predominate in giving access to all these extra resources. But small provinces like Northern Cape, which have the smallest populations in the country, do not feature at all on this list. And that's potentially quite a serious oversight.
Let's talk about the deployment of resources, because again, if we're to take what you're saying, Lisa, some of those stations that have reported higher incidence of rape would naturally need more resources, given the fact that there is actual evidence of the cases that they're recording in those places. So what does it then do for those stations and their fight against gender-based violence? I mean, you bring out a place like Toyando, which we know has been, ravaged by issues of rape for years now, and quite frankly, with very little attention in terms of additional resources from government.
Yeah, and I think that the concern is that Limpopo, Mpumalanga, and Northern Cape are not at all targeted for additional resources. So that's a concern, is that those 3 provinces don't get anything extra. So on the one hand, yes, it makes sense from the point of a term of economies of scale to put resources such as services where you're receiving the greatest number of reports of rape. Because there, you have a lot of resources reaching the greatest number of people. But if you're trying to understand why some areas have a disproportionate number of rapes relative to others, which means that you should target them for intervention programs aimed at understanding why there is so much more rape there than in other parts of the country, and what are the interventions we need to put in place to reduce the risk that women are facing in those areas, then the method they've used just doesn't work, because they're not getting to those areas where the number of rapes is disproportionate to the size of the population. So Northern Cape would be somewhere to look at, because in the past, where you have control for population, there are places in the Northern Cape which do come up as very high risk.
You've raised the issue of the Tutuzela centers as being a key resource in as far as data for determining which areas may well be the most affected by rape and, or other forms of violence.
Yes, and I think, what this analysis really points to is, I think, the weakness of some of government's data collection systems. So the police probably provide the most reliable, after a fashion, forms of measurement of gender-based violence. The Tutuzela care centres are also not bad, but I think we could be looking at how could we make the courts a much better resource? How could we be using the number of women who go to hospital, the casualty section, to report domestic violence, who are not reporting to the police? How can we start gathering and incorporating data to get this better picture? How do we bring organizations who are seeing many women who don't report? How do we bring their data into the picture? So I think this exercise points to the many weaknesses in our data collection systems in the country, and force us to raise the question, how do we incorporate this and bridge and bring together these different forms of data?
There are, of course, some obvious issues of concern that would also come to the fore. We often hear about the difficulty, especially for women in rural areas, to not only report incidents of violence, but to have those investigated and followed through. And yet again, when we look at how these additional resources are going to be deployed, they very much omit those rural areas.
Exactly, because one of the problems, the disadvantages that rural women face, and you see this most concretely in terms of Tutuzela care centres, is that in some instances, if you take the example of the Northern Cape, for example, you're having to travel 300 kilometres in order to get to that specialised service. Most women do not have the money to be able to do that, and they rely and are very dependent on the police to be able to do that, which then also puts, I think, an additional demand on policing services and takes those detectives and their vehicles out of circulation. So there really is a need to think about how do we put services at local level clinic, which are closer to women. Yes, they may not have the numbers that you see in big towns, but we mustn't deny those in small rural areas quality, competent services. So I think there's this identification of hotspots also challenges us to think about urban and rural divide and how we get services to rural areas, because they are consistently disadvantaged because of these questions of distance, and because one of the results of that is that a service in a rural area will always cost more because you're having to pay more for transport. So again, when you see budget cuts, they tend to get left out as well, because again, you have questions of distance and cost being raised. And I think the other problem that you see in rural areas is that many people don't want to work there. So there's been things like the occupation-specific dispensation to try and encourage social workers and nurses to be there, but those aren't sufficiently successful. So I think hotspots are an important idea, but they need much more development if they're going to help us to make a dent in the problem of gender violence.
And you're raising an important issue there, Lisa, because one doesn't necessarily think that the intention behind the development of this list of hotspot areas was necessarily wrong. So how then can it be better improved, perhaps to build on some of the gaps that have been identified by individuals like yourself?
Yes, I think the police have done something important in identifying these hotspots. I think what would be useful is if they were to think about how to bring together a range of different researchers working in this area who could help think about different forms of data. It would also help them to bring together NGOs who are providing services into the conversation. So I think if we were to put together a working group, were to assist them in thinking this through, to identifying different kinds of data and how this can be incorporated into it, that would be very much better. But I think it's also, a challenge to the police to not want to hold on to this process, even government, single-handedly, but to think to make much more of a collaboration and a partnership.
Thank you so much for coming on to the show today. Lisa Vetten is a gender activist and giving us her own analysis there of that particular data. You'd remember that list of hotspot areas in the country for gender-based violence, including rape. It was released much earlier in the year, but of course, the research into why the methodology behind it may be flawed continuing to come out.